Sustanon at 1,250 mg per week represents one of the most reckless and dangerous dosages of testosterone imaginable. It's far exceeding even the most aggressive bodybuilding protocols. This amount creates an overwhelming hormonal tsunami in the body, producing freakish muscle growth while simultaneously ravaging nearly every physiological system. Only the most experienced and often most desperate users venture into this territory, where the line between performance enhancement and self-harm becomes dangerously blurred. The immediate-acting esters create a massive spike in testosterone within hours, while the longer esters sustain these extreme levels for days. The result is a near-maximal stimulation of muscle protein synthesis, pushing the body's capacity for growth to its absolute limit. Unprecedented anabolic effects at 1,250 mg weekly. Sustanon's blend of 4 testosterone esters floods the body with androgens at levels 10 to 15 times higher than natural production. Strength increases become almost cartoonish, with lifters adding 50 to 100 pounds to their major lifts in a matter of weeks. Recovery is so accelerated that trained athletes can work out the same muscle groups daily without overtaxing themselves. However, these extreme physical changes come at a catastrophic cost to long-term health. Without powerful aromatase inhibitors, users experience extreme water retention, skyrocketing blood pressure, and rapid development of gynecomastia. Even with a RIS, managing estrogen becomes a nightmare, as the slightest miscalculation can lead to either severe estrogenic side effects or dangerously low estrogen levels, both of which carry serious health risks. The hypothalamic pituitary testicular axis is obliterated, with the testes rapidly atrophying due to lack of stimulation. Blood pressure frequently exceeds 180/110ths mmHg, placing users at immediate risk of stroke or heart attack. Hematocrit levels rise so high that blood becomes sludge-like, drastically increasing the risk of deadly clots. Lipid profiles are utterly destroyed, with HDL cholesterol crashing to near-zero levels while LDL cholesterol skyrockets. These changes accelerate atherosclerosis, meaning even young users can develop the arteries of a lifelong smoker in just a few months. Unlike lower doses, where partial recovery is possible, 1,250 mg weekly often causes permanent damage to the hormonal system. Many users never regain normal testosterone function, even with extensive post-cycle therapy. Enzyme levels often triple or quadruple, indicating significant hepatic strain. Kidney function deteriorates due to extreme blood pressure, protein overload, and electrolyte imbalances. Dark urine, frequent urination, and even kidney stones become common complaints. Long-term use at this dosage can lead to irreversible organ damage. Users report staggering muscle gains, sometimes 5 to 7 pounds per week in the early stages as nitrogen retention and glycogen storage reach unnatural levels. Initial hypersexuality gives way to erectile dysfunction as prolactin and estrogen overwhelm the system. Testicles shrink to the size of raisins, and sperm production halts completely. Many users become temporarily or even permanently sterile. Recovery of normal sexual function can take years if it happens at all. Roid gut develops as visceral fat expands and organs enlarge. Hair loss is rapid and often permanent. The face becomes bloated and distorted due to water retention and altered fat distribution. Injection sites become scarred and infected from the sheer volume of oil being injected weekly. Sleep becomes nearly impossible without sedatives, as night sweats and restlessness plague users. Some develop steroid-induced psychosis, experiencing paranoia, delusions, or uncontrollable rage. Post-cycle depression is so severe that it has led to suicides among long-term abusers. The muscle gains come at the cost of destroyed hormones, ravaged organs, and a lifetime of health complications. No competitive advantage is worth the irreversible damage this dosage inflicts. Those considering it should understand. This is not bodybuilding anymore, it is a slow suicide. Total endocrine annihilation. The body's natural testosterone production shuts down completely within days of starting this dosage. The body becomes so dependent on external testosterone that natural production may never recover. Many end up on lifelong testosterone replacement therapy, but even then they never feel the same as they did before such extreme abuse. Rotator cuff tears, biceps ruptures, and pec detachments become frequent occurrences. Joint pain is constant, as rapid weight fluctuations and hormonal imbalances degrade cartilage and connective tissue. Many users at this level end up with chronic injuries that plague them for life. Estrogen levels spiral out of control due to excessive aromatization. Life-threatening cardiovascular strain. The cardiovascular system is pushed into crisis at this dosage. Liver and kidney damage despite being an injectable steroid. 1,250 mg weekly places enormous stress on the liver. Musculoskeletal collapse. While muscle growth is explosive, tendons and ligaments cannot adapt quickly enough to support the newfound strength. Severe psychological effects. The mental toll of 1,250 mg weekly is devastating. Mood swings are so extreme that users describe feeling bipolar, cycling between manic aggression and crippling depression. Sexual dysfunction and sterility. Despite the high testosterone levels, sexual health is paradoxically ruined. Physical deterioration. The skin becomes a battlefield of acne, abscesses, and stretch marks. The point of no return. Most users who reach this dosage find they cannot stop without severe consequences. Conclusion: Sustanon at 1,250 mg per week is not performance enhancement, it is physiological sabotage.